Great. Hopefully everybody can see my opening slide now. And I'm so excited to be here presenting today, especially hearing about the really exciting work that Stephanie and Brian have shared with us so far. Thanks for those great talks. I'm Dr. Jodie Gawryluk. I'm a member of the psychology department in the Division of Medical Sciences at UVic. And today I'm here to be talking to you about neuroimaging changes in the brain in healthy aging and Alzheimer's disease. As I'm getting started, I wanted to acknowledge with respect the Lekwungen peoples on whose traditional territory the university stands, as well as the Songhees, Esquimalt, and Wasanish peoples whose historical relationships with the land continue to this day. And here you can see a map of the campus of University of Victoria and the different territories in this area. I'm coming to you today not from campus, but still from the territory of the Wasanish peoples, which I'm grateful for. So throughout the presentations today, we've been talking about pathways to lifelong health. And I think aging is a really important topic, partly because now for the very first time in Canada, we have more seniors than kids under age 15. And you can see that that just started changing around 2020. And this is a trend that's projected to continue over time. We have an aging population in Canada and also globally. Now, with an aging population, of course, comes an increased risk for age-related disorders such as dementia. And here you can see some stats for Canada. So we have about 750,000 Canadians currently living with some form of dementia. And worldwide, it's about 44.5 million people who live with dementia. Of course, this has economic burdens and caregiver burdens. And when we think about the number of people that are affected by dementia, it's really so many more when we think about the caregivers and the families that are involved. Now, when we think about dementia, it's really an umbrella term that we're using. So dementia can mean many different things, but really the most common form of dementia is Alzheimer's disease. About 60 to 80% of cases of dementia are Alzheimer's disease. And this is a progressive brain disorder that interferes primarily with memory, but also with other thinking abilities. So it can also affect things like problem solving and abstract thinking, or our visual spatial skills. And I'll talk a little bit more about that in a bit. Now, when we look at the trajectory of normal aging, and you can see that line here, we do see some changes over time. So we expect with normal healthy aging to see some declines in our cognitive function over time. However, when we're looking at the continuum towards dementia, which you can see here, that line becomes much more steep. So here we're looking at cognitive decline or changes over time in years. And what I'm really interested in looking at are changes in the brain that happen, or differences in the brain that exist between people with dementia and people that are experiencing normal aging, whether we can see changes in their brain at this time point, but also earlier on, before those symptoms start to really present. So what I'm really talking about here is the idea of a biomarker. And a biomarker can be defined as a biological factor that can be measured to indicate the presence or absence of a disease or the risk of developing a disease. And when we want to try and measure a biomarker, really there's some things that would be ideal. So we want to be able to use a tool that's non-invasive, that's easily repeated, and that's widely available. And this is the reason why I use MRI, or magnetic resonance imaging, for my work. So MRI is a way that we can take high resolution pictures of the brain. We can look at brain structure and function. You can see a picture of a scanner here. So maybe some of you have had an MRI before. This is basically a big magnet that you're looking at with a bed coming out of it. When we want to do a brain scan, we have you lay on the bed, and we put you right into the center of that magnet, and that's where we can take the really nice pictures. And I'll show you an example of what those look like here. So here you're looking at the side view of someone's profile, and you'll see what the brain scans look like moving from one side of the brain to the other. So you can see really highly detailed pictures of the brain. So my group uses MRI approaches to look at both brain structure and brain function. We use this in a few different ways. So really, I consider this to be a multimodal technique because we can get a bunch of different measurements all at once using MRI. So just some examples here, you can see we're able to look at anatomical MRI. This can reveal the details of brain structure. And here you can see just a side profile of a person. So their brain right at the midline, which we can get a really nice detailed picture of. And we can get that with different contrasts, which would give us different types of details about what's happening in the brain. We can also use a technique called diffusion tensor imaging, and this will reveal the microstructural details about the brain's connections, or the white matter in the brain. And here you can see a few different ways that that technique is used to recreate those connections, but also to show us where there might be changes or differences within the brain's connection. And I'll talk a little bit more about this technique in particular today. Another way, though, that we can and do use MRI is to look at brain function. So this can reveal which regions of the brain are functionally connected to each other, or the areas that are involved in certain tasks that we ask people to do when they're in the MRI scanner. So my group uses these different MRI approaches, and we also combine them with other types of measures. So we usually do also neuropsychological assessments where we can get an idea of how a person is doing cognitively, so different types of thinking skills, like memory or problem-solving abilities, for example. We also want to know how those changes in the brain relate to things like mood. So if a person is experiencing depression, how might that change brain structure or function? We're interested in lifestyle measures, so things like physical activity level and the impact that that might have on the brain. And also whether there's different genetic factors, so certain genetic risks for diseases like Alzheimer's disease that might lead to differences in brain structure or function that we can detect before a person develops symptoms. So all of these different techniques combined can hopefully help us improve our understanding of changes in the brain that occur both in Alzheimer's disease as well as in healthy aging. Now here you can see an example of some results from a study that my group published that looked at differences in the brain's connections in 34 people who have Alzheimer's disease compared to a matched group of healthy people. And all of these individuals were about 75 years old. You can see the split of males and females in the study. And this was a pretty highly educated group with about 15 or 16 years of education. What you're seeing here are the brain in different views. So in this first window, you can see the brain from kind of a side profile. In the middle view, you can see the brain kind of head on. And then in the third view, you can see the brain as if you're looking down on it from the top. And what I really want to draw your attention to here is the white matter in the brain, which are the connections within the brain. And you can see those areas here highlighted in green. So what we did in this study is we're looking within those connections in the brain to see if there are differences between people who have Alzheimer's disease and these matched healthy aging adults. The areas that you can see here in blue are the areas where we had decreased integrity of white matter or neurodegeneration in those connections for people with Alzheimer's disease. So that's all of the blue regions that you can see here. And what you'll notice is that it was really widespread. So we can see those differences in many different regions of the brain, but we do especially see them in these areas that are responsible for helping us make new memories. We also wanted to look at changes that could happen over time for both of these groups. And so here you can see for the people that were in the healthy aging group, and then also for people who were in the group who had Alzheimer's disease, again, looking at the brain in those three views. And the blue areas are showing us the regions that had some deterioration in those connections over a 1-year period. So looking at healthy aging, we do see changes over time within a year, but we see many more changes over time in more regions for people who have Alzheimer's disease. So that last study that I was telling you about is really comparing people that are on this part of that trajectory in the dementia area to healthy, normal aging controls. But we're also interested in whether or not we can detect differences in the brain at these earlier time points in this region called early memory impairment. So are there differences when we're looking much earlier on before those symptoms are presenting so severely? And so in this study, we were looking at 30 people with that earlier type of memory impairment compared to healthy controls. Again, looking in these 3 views of the brain and looking within all the areas in green as the connections in the brain. And we could see differences in all of the blue regions here between people with this early impairment compared to healthy controls. So we could detect those changes really early on. But one of the most interesting things in this study was that the changes weren't exactly in the same regions that we saw with Alzheimer's disease. They did overlap, but they were more so in the front parts of the brain. And this is a part of the brain that's responsible for helping us with kind of abstract thinking and problem solving. And in follow-up analyses, we saw that that relationship was really strong between those thinking skills and these changes in the brain that we see earliest on. Now, after seeing changes in the brain that happen with Alzheimer's disease, often people wonder, what are the warning signs of Alzheimer's disease? How would I know what types of symptoms that we're really talking about here? And so I'm sharing with you this really nice infographic that was put together by the Alzheimer's Society. And this is what the 10 warning signs of Alzheimer's disease. So you can see here, memory loss that affects day-to-day activities is the #1 warning sign. And so we talked about how changes in memory are the primary symptom that presents with Alzheimer's disease. And this isn't talking about kind of normal forgetting. Everybody forgets where they put their keys once in a while, but we're talking about changes that really affect the ability to do day-to-day tasks. Some of the other warning signs include difficulty performing familiar tasks. So maybe, for example, cooking a meal that you're really familiar with making and having trouble with that. Problems with language to the extent that it becomes hard to understand what the person is trying to say. Some people get disoriented in time and space or get lost in familiar places, or have impaired judgment, like not dressing properly in really cold weather. There can be problems with abstract thinking, such as balancing a checkbook, or sometimes misplacing things. So for example, putting the milk in the cupboard, putting your clothes in the refrigerator. Sometimes people will present with changes in mood or behavior, can become confused or suspicious, and act in ways that aren't characteristic of their personality. And sometimes people will also experience loss of initiative or not showing the same interest in activities that they used to enjoy or interest in their family. So those are some of the warning signs of Alzheimer's disease. If you or someone that you know are experiencing these symptoms, I would definitely encourage you to reach out to your doctor and get checked up. There's also, the Alzheimer's Society has a really helpful First Link dementia helpline that you can call to ask about some of these symptoms. Now, on the other hand, you might wonder, what are some tips for healthy aging? And so here are some things that we usually encourage, and staying active with hobbies. If there's things that you like to do, definitely keep doing those things. Keep engaging and getting out there. Stay social. When we're socializing, there's so many different cognitive skills that we're using. We have to pay attention to the conversations. We have to try and remember people's names. We have to keep track of the conversation and what's happening. And so there's a lot of different thinking skills that we're practicing and keeping active when we stay social. It's also really important to keep moving. So keeping physically active can help not only with our thinking skills and our brain health, but also with our mood. And so it's really helpful to keep active. Eating a good diet is usually really helpful as well. And if you are experiencing any concerns about changes in your thinking skills, start the conversation and express those concerns to your family and to your doctor. And on that note, I'll end here by really thanking all of the lab members, current and former within my lab, that were responsible for all of this work. And I'm so grateful for their contributions. Thank you.